Yeah, thank you for being there. We have said so much about politics on the program this morning. Now we are shifting gears into the health sector. Health, like we know, is wealth. But precisely, we'll be looking at hypertension, the unseen silent killer, on the program at this moment. May 17th is annually observed as the World Hypertension Day. And of course, hypertension, like I did say, is also known as the silent killer. The 2026 campaign centered on the theme controlling hypertension together. Check your blood pressure regularly, defeat the silent killer. We'll be having this conversation with Dr. Damilare Soyemi, Senior Registrar, Family Medicine Department, LASUTH. It's a pleasure to have you.
It's good to be here. Good morning,
so
sir.
much
Thank you for
All right.
bringing me.
Even though May 17 was the World Hypertension Day, we feel there is need for us to discuss this silent killer because many Nigerians are not even aware of what hypertension is. So let's start from the proper definition of hypertension and why it's usually called the silent killer.
Okay, thank you so much for inviting me and for this very important topic that we are discussing. We need to keep doing it together. According to that theme, controlling hypertension together. So what is hypertension? I'm going to break it down because we are not in a medical class. So as much as possible, I will use relatable terms. Now, simply, the pressure that the blood that flows in our blood vessels exerts on the walls of those vessels. So simplifying it is this way. Okay, we all have pipes running around us into our homes, providing us with water. So there's a flow of water through those pipes, and for any reason, if that pressure is so high, it may be enough to damage that pipe or any of those pipes. Now, that is the way I'm going to describe what hypertension is. There's a normal flow of blood through the blood vessels. However, when this pressure becomes higher than normal, then the individual may be tend to have high blood pressure. And now there's a difference between high blood pressure and hypertension. I need to make that clear. Yes. Now, hypertension is a medical diagnosis, and it normally should be a diagnosis made by a medical doctor, a professional. Okay, but an individual can have a high blood pressure. Now, normal blood pressure should be around 120/80. In fact, it should be less than that. It can be less than that, and that is, it can even be up to as low as 90/60. Okay, so anything below that, we'll be talking about hypertension, which is not also good. So between that 90 to 120, 60 to 80, I'm talking about the systolic, that's the higher value, and then the lower values when we check. So that's why I brought this. It shows that systolic here, and it shows the diastolic below. And then the third one there, the reading is the pulse rate. So now, generally, globally, the acceptable reference is 140/90, even though there are so many other ranges.
120/80.
Okay, defining hypertension.
Okay.
So to say that an individual has hypertension now means that because people may have something like around the borderline between 120 to 140 may still be acceptable, and depending on the age range. So there are so many things around making that definition. Now, for generally acceptable reference, that's the 140/90. Anything above that, the individual may be said to have high blood pressure, not necessarily hypertension. So now hypertension, it has to do with the fact that we do this reading at least 2 or 3 times, 2 to 3 times, and then we have this consistent reading above 140/90. In fact, that systolic may be 160, and the diastolic, that's the lower value, may be 70. The individual still has hypertension. If that reading consistently, it's persistently
remains like that,
160, 170, even 150.
Okay. So, but we've also in recent times, and I'm glad you also, the age thing came up while you were explaining a while ago. Usually, I mean, the norm was that at least it probably will be older people that may come down with hypertension. But I mean, it's been seen recently that age is no longer a factor. And depending on, you know, what these people are exposed to or individuals are exposed to, you could actually be diagnosed with hypertension. How did we get there? Is this also, is it because of our style of living, our way of living, or is there any medical explanation for that?
Okay, thank you for that very important question, and that's what people are asking. Now, talking about why we are now seeing hypertension coming up in younger age groups. Hypertension is no longer about the older population, older age group. And I will tell us why. Now, the fact is that our cells age. Aging is a normal process, and what aging of the cells actually means is that the cells are not able to now perform the functions that they used to perform before. So our cells change, the skin, different parts of our body with different cells. Now, even the blood vessels that are made up of cells. So there are changes that occur. You know, we talk about the anatomical structure, what we can see, but there are changes that occur based on different factors. I'm going to mention them. Okay. And age is one of it. Now, in age, because of this process, changes in the cells, and then there are some changes that occur on the blood vessels themselves. They may become thickened. They are no longer able to carry the flow of blood as they should, because there's a normal flexibility that the blood vessels should have so that the blood can flow properly and then supply the different organs. Now, the reason why we are having the younger age group developing this, so to say, what was actually known as a condition for the older age group, is because of a lifestyle, like you mentioned, ma'am. Okay. Yes, and that has to do with unhealthy eating. These days, processed foods, fast foods, sedentary lifestyle, and so sitting at your desk, working remotely, individuals tend to place orders. Maybe sometimes, nothing wrong about that. But this consistent lifestyle predisposes individuals, even young ones. Somebody in their 18, between 18 and 20 can have hypertension. And I will tell us other reasons. Okay. Now, the lifestyle is a very important factor. Now, the diet, I'm talking about unhealthy meals, processed foods, fries, and in fact, even sodas. Yes, they cause a lot of inflammation. And inflammation on these blood vessels will affect their function for that flow of blood to be normalized. And so when there's a challenge with the flow of blood, the heart is trying to compensate, trying to adjust itself. And so that's
why the heart is under pressure. It's
under pressure. So it keeps trying to force and then keeps pumping. We'll talk about the complications. So other factors, risk factors, include the non-modifiable factors. Age is one of it. The race is a factor, African. We said to have this tendency to retain salt, and sodium salt has been implicated. So when we're talking about unhealthy diet, we're talking about high consumption also in high sodium salt. And this is not just about table salt. Interestingly, WHO has actually recommended that we have less than 5 grams, and that's about a teaspoon in 24 hours. Now, do you know that other forms, other ways people actually get salt is through other condiments? You know, we talk about our curries, maggies, you know, the seasonings, and this actually increases yes, the exposure of individuals to sodium salt. Okay. And there are other factors. Let me quickly mention other factors, apart from race, apart from age. Also, women who get pregnant sometimes develop this condition, especially those who also have a strong positive family history of hypertension. Those are non-modifiable factors, things we cannot change. You cannot change our aging process. We can only try to adjust and make sure that we're living healthy, and then we cannot change our race. We're already there, Africans, especially African Americans, even Asians. Now, do you know that there are modifiable factors? There are things that we can do. They also affect. Those are the dietary aspects that we've mentioned.
I'm sure we'll talk about that. Okay, but let me quickly just build on what he said earlier, just before I forget. Yes, is it also hereditary? Because you mentioned family factor can also predispose one to this. So is it also hereditary?
Yes, hypertension is hereditary. Now it is classified as a non-communicable disease. So it's not
by touching,
by coughing, maybe by his coughing, so the next person can get hypertension. No, but there's a genetic component. That's talking about the cellular level. That's what I was trying to describe about cells generally, the basic form of organism, life for man. So the same way a man or a woman, looks like their father, looks like a mother, one uncle there, because of the genes, the same way they can be that inheritance. And then coupled with the fact that the same individual is from Africa or Asia, or even in the Western world. In the Western world, a lot of these habits and all. So it is inheritable, but it doesn't automatically mean that because a generation before had hypertension,
you must have
the next generation is going to have
okay.
it.
All right.
Okay. Earlier, while explaining what hypertension is, you did say that when the vessels or the arteries are blocked, I would like to know, when those vessels or arteries are blocked, what are the likely consequences? That's number one. And the fact that we have tagged hypertension an unseen silent killer, does that mean that there will be no symptoms for anyone to notice if your blood pressure is high?
Thank you for that important question, sir. Now, as I am seated here, as you are seated, some things are happening in the body, in our bodies, and then we are not conscious of those things. For example, my heart is beating, but I can't hear it. But the way I can know is to place a stethoscope. Someone can check that for me, and then listen to my heartbeat. Same applies to you, the same applies to you. So the heart is functioning, and then other processes are taking place. The heart pumps blood to supply different organs in the body. And the heart itself also receives blood supply. And it is because of this normal pressure or flow of blood that makes the body able to function well. So that's why the individual, the same way you're talking about being silent, my heart is pumping blood. It's silent.
You can't hear it.
I can't hear it. But I know because I'm receiving blood supply to all the parts of my body because they're able to function, to talk, able to see, able to digest food and so many other processes that occur. So it is silent because things happening in the blood vessels, which are hidden in the body. And then before their effects manifest, because there are numerous blood vessels, arteries specifically, supplying different organs, so they may be supplying, and it's a long-term thing. That's why we call it a chronic medical condition. So it's a long-term effect. The vessels are wondering what's happening here. There's a bit of pressure from the heart pumping. Something's happening to us here. They are trying to understand what is happening, and then they are trying to see, okay, is there going to be a change? Is there going to be a reversal so that we can function normally? But once those mentioned lifestyle factors, non-modifiable factors are consistently, as one individual is consistently exposed to them, then the vessels begin to take a shape over time and then begin to manifest in reduction in the blood supply. For example, if there's a blockage, especially for those who have coexisting medical conditions like diabetes, also inflammatory, and a condition that makes blood to even clot. Then cholesterol levels. We're talking about high cholesterol levels. So the vessels are finding it difficult to now perform their function because the walls are taking, and then there are things that we call plaque. When fat begins to deposit on the blood vessels, and then the pressure is increasing. So there can be a blockage because so many deposits there, and they're coming in to say, no, what's going to happen here? Let's just stay somewhere. Let's just find a place to stay. So they block, depending on where they block, whether it's in the brain, the individual now begins.
So would there be no signs at all?
Yes.
For you to even notice?
That. Yes. Initially, there are no signs. So by the time signs are coming up, individual may actually be having some complications, no matter how mild. Yes. Okay. So that's why it's important to check. I intentionally brought this so we can actually know how important it is to check, even if you have no symptoms. We don't need to wait. But I'll mention some of the symptoms that individuals could have. Yes, including headache. Headache is non-specific. Malaria could cause headache. So, but not every headache is due to stress. It's due to malaria. It's due to low blood sugar. It could be hypertension.
Okay.
And interestingly, many of the people that were found to actually suffer from a bleeding into the brain, which is a complication, one of the complications of uncontrolled hypertension that leads to a stroke, is those who have very high blood pressure.
Okay.
And they sometimes, most of them complain of severe headache.
Okay.
I don't know if you have heard news of people who have actually, suddenly
Collapsed.
passed. Yes, some of them, they complain of severe headache. Other complications, other symptoms include hearing of heartbeat, palpitations. Like I said earlier, it's not normal for an individual to hear their heartbeat. There are situations that can make an individual to hear their heartbeat.
Right.
Anxiety, panic, person is fearful, need to perform maybe an interview. Those are occasions.
Or when you exercise.
Exercise, yes. Thank you, sir. Now, do you know that when an individual hears their heartbeat consistently, repeatedly, it's not to be ignored? Then chest pain may radiate to the arm, may radiate to the back, angina. And then do you know that there are other things like blurring of vision? And because the blood supply vessels, depending on which vessels are affected,
Okay.
will determine the manifestation that the individual gets. So if it is the brain, commonly, even the kidneys. So by the time the kidneys are showing signs, we're talking about complications.
Inflammations already, okay.
So there are many other symptoms that some people sometimes feeling tired easily, fatigue. Some people having puffiness of their face, swollen feet, and that's talking about complications setting in.
All right, so you've talked about the facts that yes, you may not initially have symptoms, but definitely these symptoms will start coming at some particular point in time. There's also this thing that I know that a lot of people say, especially in the medical field, know your numbers. So when you say know your numbers, of course, constant check-in of your blood pressure is one, cholesterol is also one. So how often should you check? How often should you compare your numbers when you check? So when you say take your blood pressure, should it be every day, or should it be every week, or should it be every month? Because again, maybe not everybody would be able to afford, the reading meter, but then people could actually also go to pharmacies or places to pay to get these things done. But medically, how often should you check and compare your numbers?
Thank you for that very important question. We are doing this together, controlling hypertension together, according to the World Health Organization's theme for this year's celebration. So talking about how often, there are many factors, different factors that determine how often the blood pressure should be checked. For the general population, we talk about different areas, nations, regions at risk. Okay, now in Nigeria, globally, first of all, 1.4 billion people are said to be affected by hypertension. And then in Nigeria, 70 to 80 million persons. So there needs to be increased awareness, consciousness. So talking about this is not to bring fear, anxiety, but it's just to
create the awareness.
And then preventive measures. So checking for anyone that doesn't have a strong family risk factor for hypertension. But when I say that with caution, because 1 in every 3 to 4 Nigerians is hypertensive. I don't know if there's anyone here that is. But so what should be done regularly is at least once in a month.
Okay.
Generally.
Once in a month, at least.
Yes. Once in a month. Okay. But there are recommendations for different individuals. For example, for an individual who has been diagnosed with hypertension, I won't say check once in a month. Okay. As a medical doctor, I will say, of course, if possible, check every day as you are taking your medications. But you can check every other day. Okay. But you should not go in a week without checking your blood pressure, even if you are on medication. Right. So we have people come in and say, oh, I've been taking my medications. When was the last time you had your blood pressure checked? Oh, no, it's been a long time. But by the time the individual is in the clinic, we see the blood pressure is high. So that may require changing medications, making some adjustments. Okay, so but there are other situations where individuals may be recommended to check maybe for certain times in the day. For example, early morning checking. Okay, generally, that's what is preferred. Early morning as you wake, and then
before you
go to bed. Very important, because there are factors that change. Our activities change, the blood pressure, eating, taking meals change our blood pressure. So generally, that is what can be done. But for pregnant women, for example, a woman that comes for antenatal clinic, because I said there's a risk there too for women, that comes to antenatal clinic, generally when any individual attends a clinic, any hospital, the normal thing, the vital signs are checked, including the temperature, the pulse rate, the blood pressure, generally. So any exposure, any encounter
can be picked immediately.
Yes, so it can be picked. So, and we have other occasions where people can check. We talk about medical outreaches, our primary health care centers that are open. There's a lot that even the Lagos State government is doing, creating awareness. In fact, there's the technical working committee on non-communicable diseases, and that's part of the effort. So it's a joint effort, not just about the individual. There are occasions, people that can't afford this, just like you said.
Right.
They have opportunities to go to pharmacy to check. They have opportunities to go to their nearest maternity center
the
to
health
check.
centers.
Yes, primary care center.
Okay, so for those who can afford to buy these machines, how would they know the authentic ones to buy for them to have the correct readings? That's on one side. And I've had people at different fora say that I decided to abandon my medication because of the side effects, weakening of muscles, sexual dysfunction, and so on. So what are the likely side effects of those that are taking these medications? And how do you know the right BP machine to buy?
Okay, which one should I start?
Anywhere you're comfortable.
You can start it from anywhere.
Okay, so this occurred to me as I was coming in. You know, there are different types of this. Thank God there's no branding here, so we're not mentioning brands. Also, there are many people producing this, many companies. And so there was a time we're using this fig, and we still use for places that may not have access to this. But globally now, digital is recommended. But when it comes to knowing which to buy, then it's important to check in with those who are into this. Even though your doctor can talk to you about this, but we are usually careful not to talk about brands. We recommend when maybe you have a client, and then from experience, the ones that have been used. Okay, so going to a store, there are stores where they sell medical equipment. You can get a very good store where you can get a good, one. And then when I say good one, over time, some of these machines, after some years, they wear out, so you may need to replace them. Sometimes it's also important to check with other places, other machines, to compare. You may take it along with you. If you get any one, you may take it along with you to your doctor, to your clinic appointment, so they can probably also use to compare with what they are measuring with, even though there may be some variations. And then the
side effects.
Side effects. This is a common one. And that's one reason why people who are dealing with hypertension, one reason why some neglect their medications. And the fact is that there is no drug without side effects. Yes. And it's usually available on leaflets. They are usually attached. So what happens is this: there are some tolerable side effects, and there are some intolerable side effects.
So give us two.
Yes, very good. Tolerable, for example, means that if an individual takes an antihypertensive, for example, and then they feel, after taking it, they feel like maybe a little light, and not something massive, and then making them to feel like falling, but feeling like that. It may mean that they just need to catch some rest after taking that medication, drink enough water, rest, and then move on. Okay, so that may be tolerable. Some mild headache sometimes, because they list some of those things. Some people have nausea, feeling like vomiting. Some people have some abdominal discomfort, maybe mild, but when it becomes severe, that's intolerable. Individual needs to present to the hospital. Individual with severe headache, even after taking medication, needs to present, because some of these medications have those side effects. Some people even have swelling of their ankles. I may not be able to mention all these, all the specific medications. But
as soon as you see
anything, hypotension is another one. Okay, sometimes individual takes antihypertensive and then they get dizzy, you know, they feel like they want to fall. Sometimes it's because the blood pressure is now too low. So that's why sometimes when this prescription is given, your doctor will say, please check your blood pressure. That's why it's important to check. Check, you know, after maybe every day, and then give me a feedback. In fact, you need to record it. You need to have a blood pressure
recorder where you write your numbers.
Blood pressure recording. And then with that, we can know, oh, this individual is having a good control with this medication, or we need to do some modifications.
I also, based on a follow-up to that, I actually had a question, but let me quickly follow up on this. Okay. Based on, you know, patients also reporting back after using certain medications, are there times that you might need to either stop them from using certain medications and then placing them on other medications because of the intolerable level of those medications, or are there times that you have to let them stop using certain medications before you prescribe other ones? Have you also had issues where, because again, I know that there are non-generic medications, and so do they also have side effects on patients when they use certain, I don't want to mention medications here, but again, sometimes when you have generic medication of other medications, people sometimes may not be able to tolerate properly. So do you also have patients presenting with such cases? That's my follow-up question to Ajibola's question. And then the other question is hypertension curable? Or once you're diagnosed with it, all we have to do is to manage you for life? So 2 questions for you.
Yes, thank you for those 2 questions. Now, there are drug-drug interactions that occur, just like you're trying to say. There is drug-food interaction. Okay. Interestingly, I've seen patients who say, when I take this medication, antihypertensive, I get some burning sensation.
Okay, let me hold your thoughts on that. We need to take a commercial, and we'll be right back.
Okay, thank you.
Progress.